Now we are on live. We are good to go now, Kitty.
Okay, thank you. Hello, everyone. Thank you for joining today's session on your favorite channel, Cancer Reach. Cancer Reach is an initiative by our very own doctor, Dr. Krishnamani, to spread awareness about cancer and help patients and caregivers to access the right treatment at the right time. As we step into 2026, conversations around health need to move beyond just treatment and hospital visits. Cancer care today is not only about managing disease, it's about prevention, early detection, lifestyle choices, and informed decision making. In this session titled New Year, New Health, What Your Oncologist Wants You to Do Differently in 2026, we'll discuss simple but impactful changes that can lower cancer risk, improve outcomes, and help people partner better with their doctors. This discussion is meant for everyone, whether you're a healthy individual, you're an at risk person, a survivor, or a caregiver, because when it comes to cancer, awareness truly saves lives. Joining us today is Dr. Krishnamani, one of the most respected voices in oncology. He has been with AY hospitals here in Hyderabad for more than a decade, where he is known for his expertise in managing solid tumors, blood cancers, and oncological emergencies. Dr. Krishnamani's journey spans international fellowships and leadership roles at some of India's top cancer centers, giving him a truly global perspective on cancer care. He's also contributed immensely to the field, from shaping treatment protocols to influencing cancer care policies and driving research that really makes a difference. He's not just a brilliant oncologist, but a trusted guide and an ally for so many patients and families navigating their cancer journey. We're truly honored to have you here, sir, with us.
Hello and welcome to Cancer Reach. Thank you. Cancer Reach is an initiative to spread awareness on cancer. So today, as you said, let's talk a bit on what are the challenges we face and how we can deal with those challenges in this new year.
So, sir, we will be discussing regarding the lifestyle choices, early detection, prevention, everything in detail. Sir, can you tell us a few myths or misconceptions about cancer which you really feel patients should leave in 2026?
So, one myth is cancer is not curable. That's a myth. That is a completely, false statement. Cancer is curable. Cancer is curable if detected early. It's one of those few diseases which can be curable. Then cancer cannot be detected early is another myth. Wrong. Cancer can be detected early. What are your common cancers? Breast cancer, you can detect a lump. You find a swelling in your breast. You find the nipple going inside. You find change in the skin over the breast. Could be breast cancer. Go consult your doctor. So you can detect it very early. Uterine cancer. A woman after her periods have stopped, that is after menopause, she develops bleeding. Go consult a doctor. Could be endometrial or uterine cancer. Yeah, you have an ulcer in the mouth which is not healing. Could be head and neck cancer. So you can detect it early. You just need to know. You need to be aware. So cancer can be detected early. Cancer is curable if detected early. Cancer treatment is very expensive is a myth. Not really. Many cancer treatments, many chemotherapies are not at all expensive. Available in government hospitals also for the poorest of the poor, even under the state-sponsored health schemes like Pradhan Mantri, Ayushman Yojana or Arogyashri, etc. So, what else? There's so many myths regarding cancer. And now, cancer is deadly and you're anyway going to die even if you have early stage cancer. No. Early stage cancers are highly curable. Stage 1 breast cancer is more than 95% curable. Stage 3 is also more than 70% curable. Stage 4, though not curable, you can really prolong those patients' lives for more than 3 years, 5 years, sometimes even up to 10 years. So, the fact that cancer is deadly and once you get cancer, it's a death sentence, that's all wrong. If it's an early stage, please treat it, with the same amount of respect and speed and urgency so that the disease is cured and the patient is fine.
So, when you look back at the year 2025, what is the one health habit you wish more people had changed earlier?
So, I would rather than saying changed earlier, I will say quit, which is smoking. So, not only 2025, even if you talk about this in 2050, I'll tell you quit smoking. quit tobacco in all its forms like zarda, pan masala, gutka, khaini, and all those forms. So quit tobacco, quit smoking.
Sir, can you elaborate on the few risk factors, the most common risk factors for the general cancers?
So cancer risk factors can be personal risk factors, can be genetic risk factors, can be environmental risk factors. When you talk about personal risk factors, tobacco is high in the list, smoking is high in the list, pan masala, gutka, and all that. For head and neck cancer, there are more than 14 types of cancers caused by tobacco or nicotine that ranges from head and neck, lip, tongue, buccal mucosa, throat, larynx, foot pipe, stomach, prostate, urinary bladder, leukemia, pancreatic cancer. So, smoking, tobacco, alcohol, which causes HCCs or liver cancers, then hepatitis B virus and C virus, which leads to liver cancers, human papilloma virus, which leads to cervical cancer. That's why the cervical cancer vaccine is extremely important for girls, especially to prevent cervical cancer. So your common cancer is cervical cancer, which can be prevented. Then you have your liver cancer, which can be to an extent hepatitis B, C can be prevented. Smoking is the commonest reason. So stop smoking, stop taking tobacco. These are all some of the common reasons. Um, the environmental reasons is somebody works in a coal factory, an asbestos factory, he's a pollution. They're all at risk for lung cancers. Genetic factors are the genes which we discuss, the BRCA1 and 2 genes we generally say. So somebody has a BRCA1, 2 gene, they're at a high risk of developing breast cancer, they're high risk of developing ovarian cancer and all that.
So, what are some of the most common signs and symptoms which are seen in cancer patients which should never be ignored?
So it is location specific and general. General means extreme weight loss, extreme loss of appetite. Okay, somebody is losing a lot of weight, somebody is losing appetite. Those are some concerning and alarming signs. And when it comes to specific cancer, now a breast cancer presents the breast lump or change in the texture of the skin. A lung cancer patient may have breathing difficulty, cough, or blood in sputum. A brain tumor patient may have headache, double vision, he may have paralysis, he may have seizures. A gallbladder cancer patient can present with jaundice. Okay, a colon cancer patient may present with constipation or bleeding in the stool. So, cervix cancer, endometrial cancer, uterine cancer presents with vaginal bleeding. So, a sarcoma patient, a muscle, they can present with a muscle tumor or a bone tumor. So, you have symptoms specific to a disease and general symptoms in the form of extreme weakness, extreme loss of appetite, loss of stamina, cachexia, becoming skin and bone. So, those are the general symptoms which should alert somebody to think regarding cancer.
Sir, we see a lot of young people getting diagnosed with cancer nowadays. Is it going to be attributed because of the increased awareness regarding cancer, or is it because of, or is it because the younger population is getting more cancers these days?
So, one younger population, one because they are more aware, they are able to pick it up, number one. But you can attribute the same reasons like smoking, alcohol, and all that for the young population. Genetic factors you should think about in the young population. Beyond this, if you don't really know, it is pure bad luck.
Sir, when we talk about this increased awareness, we need to shed some light on the screening. So, what are the different types of screening methods which are used for the cancer detection in different cancers?
So, by screening, we mean we are doing a test to detect a disease early. So, breast cancer, what do? You do an X-ray of that breast called mammogram once a year after the age of 45 years. So, every woman above 45 should get a mammogram every year annually. Cervical cancer, every 3 years, get a pap smear test or a HPV test by your gynecologist. From the age of 21 years, you please start it. Colon cancer, to prevent colon cancer, do colonoscopy after the age of 50, once every 10 years. Colon cancer. Okay, so these are some of the screening methodologies. In high risk patients of prostate cancer, you can do a blood test called PSA, prostate specific antigen. A family which has one or two people with CA prostate, the other men folk in the family, once they are 30 or 40, they can do an annual PSA. So this is how you are going to uh, screen yourselves. So commonly mammogram and pap smears and colonoscopies is what we should emphasize. And obviously in heavy smokers, you can do something called a low dose CT scan to detect lung cancer. But I would always emphasize that rather than going that route, better stop smoking. That is better than doing CT scans to find out if you have cancer and you continue to smoke.
Sir, since you have mentioned the scans in detail, there is also a common myth with it that if you have a full body scanning done every year or every 2 years, it is going to be more harmful. Is it actually helping the patients or is it harming them?
So there is no evidence to do a whole body PET CT scan every year for a normal person. So I'm in the hospital 365 days a year. Can I get a PET done every 3 months, even if it is free in my hospital? No. You should have symptoms to recommend a particular test. And also understand that PET scan or any of these CT scans have amount of radiation and all that, which is harmful in a certain sense. So when you look at it, you should look at the risk-benefit ratio. If you have cancer, then do PET scan. The risk is much, much lesser. The benefit is high by detecting the cancer. If you have no cancer as a screening method, it is not recommended.
Sir, before we get into the treatment protocols, what are the common diet advices that you give for all your patients?
Healthy diet, balanced diet, vitamins, minerals, fruits, vegetables, carbohydrates, protein intake, and all that. Good exercise, yoga, healthy mind, half an hour of brisk walking every day for at least 5 days a week. These are all the recommendations. Lot of fiber in the diet, lots of water to drink, fruits and fruit juices. If you are not a diabetic or you don't have such, contraindications. Good food, balanced food, fruits, vegetables, green vegetables, protein. This is what is important. Exercise and mental peace. More importantly, spiritual, mental, or emotional peace, so that you are sane. That is important. Many times we forget the brain in the body. We forget the mental aspect of things, the spiritual aspect, the emotional aspect, social aspect. Meet your friends, talk to your people, have your support system, etc.
Sir, are there any vaccines that can be used for cancer prevention?
Yes, hepatitis B to prevent hepatitis and hepatocellular carcinoma. You have the beautiful cervical cancer vaccine for both boys and girls. It should be given boys and girls between the ages of 9 to 22 or 25. And to prevent cervical cancer, vaginal cancer, vulval cancer, oral cancer, anal cancer, and penile cancer, and wart. Wart is small growths, which is the precancerous form. So cervical, vaginal, vulval, oral, penile, anal. Both boys and girls between the ages of 9 and 22 is your vaccine. In children below 15 years, you give 2 doses. In children above 15 years, you give 3 doses. But these kids should receive it before their first sexual exposure. Now, in the West, even here, we see a lot of kids having a sexual exposure at a very young age. So, the whole point is before they develop sexual exposure, you want them to have the vaccine so that they don't develop so that the virus is not there in their body to cause cancer.
Sir, can we talk a little bit about the cancer treatment, how it has evolved in terms of the scientific and the innovative molecules which are available in the market, and also regarding the accessibility for Indian patients?
So last 1 year has seen a leapfrogging in immunotherapies, antibody drug conjugates, homegrown CAR therapies, etc. Accessibility is there. All the medicines available in the West are more or less available in India. Immunotherapies are 1/4 or 1/5 the cost of the rest of the world. India patients are very lucky. We get a subsidized program. Chinese immunotherapy molecules have come where the cost is 1/3 the cost of the original molecule also. And then coming to antibody drug conjugates, that is a new thing which has come up in the last 3, 4 years or 5 years. In 2026, there is a drug called NHER2 in breast cancer. There have been a lot of trials, not only in stage 4 in later lines, they are using in stage 4 in the early lines also. And now there is some data to show that it works well even before surgery. So they are trying to push the drug not only in stage 4, in stage 2 and stage 3 patients also. Enhertu is an antibody drug conjugate. That is, it has a chemotherapy which is inside, and it has a linker which goes and attaches to the cancer cell and releases the. So ADCs or antibody drug conjugates and immunotherapies, good supportive care, all these things have picked up in 2026.
Sir, in terms of accessibility, is it financially also a good and a viable option for the cancer patients now?
So, see, most cancer treatments are affordable. But when it comes to immunotherapies, when it comes to newer molecules, when it comes to antibody drug conjugates, they are still expensive. See, an immunotherapy treatment on an average can cost you between 6 to 10 lakhs in a year. Okay. So, but many people may not even have that amount of salary in a year. How are they going to keep the whole salary for the sake of a drug? Then what will they eat? What will the family eat? What will they do? So they'll lead to out-of-pocket expenditure. So though India as a market, the medicines are cheaper than the West, but inside India, for the Indian population, the costs are still significantly higher, especially for newer molecules, newer oral molecules, CAR T therapy, transplants, or ADCs, or immunotherapies.
Sir, how can family members and caregivers support the cancer patients?
They are the backbone, right? So when you go home today, you have somebody at home to go and listen to all the, what do you say, yelling, crying, you and me do. If you have had a good day or a bad day at work. So same way, they have to be there. If a patient, imagine a cancer patient comes for chemotherapy on her own and goes on her own. It is so depressing. So somebody accompanies her. Now I had a patient today. She's finishing her last cycle of chemotherapy. She's always accompanied by her sister-in-law, sister-in-law's son, sister's son, husband, son, any which way. If they don't come, at least these, so the whole family. Today, the sister-in-law is asking me, sir, now the chemos are over. After the surgery, when is the radiation? For that whole radiation, I will take care of her. I'll keep her in my house. Because accessibility to care is also important. This patient stays somewhere 4 hours away from Hyderabad. So her sister-in-law stays nearby. So she says, I'll ensure that she stays in my house and she can come daily for radiation because I stay next door. You can't travel 8 hours every day up and down for radiation, right? For 3 weeks or 4 weeks. So this is the kind of support you need. You need this beautiful support of your family, of your husband, your kids, your spouse, your brothers, sisters. Then life is easy. And friends, most important. They'll help you navigate the bad or tough period.
Sir, if you could give one message to the public about cancer in 2026, what would it be?
Always, I keep saying, please don't smoke. Please don't take tobacco or alcohol in all its forms. Regular screening for breasts, cervical cancers, women with PAP and mammograms. Please take the cervical cancer vaccine for both boys and girls. Follow a very healthy lifestyle, a balanced diet. Watch out, help people in need. I think that should be enough.
Thank you for taking time out for this session, sir, and we hope to see you with many more interesting topics in 2026. Thank you, sir.
Thank you so much.